My name is Ernie Makhafola. I was born and raised in Limpopo, in Mokopane, and from there I moved into Johannesburg. I first started staying in Johannesburg rather in 2013. With my educational background from Mokopane, I matriculated in Limpopo. That's when I actually came to Johannesburg. I've been started school in 2013 in Chris Hani Baragwanath Nursing College, which is situated at Diepkloof in the city of Johannesburg. That's where I did my diploma in nursing. During the course itself, I was a student and at the same time an employee of the Gauteng Department of Health, because I was doing the diploma in nursing, which is a bursary from the Department of Health. So I completed my 4-year course from Chris Hani Baragwanath Nursing College in 2016. And furthermore, I then did short courses in nursing. My first course that I did after that was a NIMART course, which basically deals with TB and HIV. After that, I got to do APC 101, which is also related to HIV and TB at the University of Cape Town, which was a short course as well. After completing my diploma in nursing from Chris Hani Baragwanath Nursing College, my first employer was Anova Health Institute, which is an NGO which supports the city of Johannesburg, mainly with HIV and TB care. So I started there as an enrolled nurse because I was still waiting for my results. After I got my result, then I got promoted to be a professional nurse. I worked there for 2 years, from 2017 up until 2019. So in the city of Johannesburg, we're actually supporting all the regions from region A up to region G. But my main focus was at region B and C, where I worked as a professional nurse, roving around the clinics of region B and C respectively. So I was doing services such as consultations with patients, initiations of patients who just tested positive for HIV and TB. In case where we get to a clinic where they are short-staffed, I was helping in the consultation room as well as family planning outside what I was actually there for. In case I found shortage of staff, then I would help the staff with whatever that's required as a professional nurse for me to help them carry out service delivery to our people. From Anova Health Institute in 2019, I then moved to Oram Institute, which is based at the city of Ekurhuleni. It's an NGO as well. It also supports HIV and TB management in Ekurhuleni. My roles there was initiations of HIV and TB, to test as well as a clinician. So I used to test people for HIV and TB as well. And then those I found positive, then I would initiate on HIV. Those who are TB presumptive, I would do the sputums, all the management of TB, and then we start them on ARVs, or we start them on TB treatment. So my role as well at Oram Institute, I was a nurse lead in the facility. I started as a nurse lead in the facility, which means all Oram employees in the clinic or in the facility, they were actually reporting under me. Then we didn't get a fund grant in 2022. That's when Oram had to actually leave the city of Ekurhuleni. Then came that RHI, which is an NGO as well, which had to take over from Oram and be in support of the city of Ekurhuleni. That's when I got to be employed there as well as a nurse lead until recently. So with the employment at VET RHI, my roles was also as a clinician. So this time around, I had to be a roving nurse. So I was a cluster lead. So I had to do 9 facilities where I was roving, checking out where they need help or assisting our employees or the employees at the city of Ekurhuleni who actually maybe need in-service trainings. We would organize in-service trainings for them. I would also help where there is staff shortages, because staff shortage is across actually the cities. So where we get problems of staff shortage, and then we have to now assist with whatever that you can assist as a clinician. So with those roles, I then did a PC or a PC 200, which is a course that's done with regards to the management of TB and HIV, and then I completed that. I did a number of short courses while I was employed at Vets RHI, and then finally I applied last year, December, for a management of HIV and TB postgraduate diploma, which I'm currently doing now at Stellenbosch University. So I joined the EFF in 2014 while I was still a student at Chris Hani Baragwanath Nursing College, and I joined at Orlando West because that's where I was residing at that point. And then from there, I was elected the branch treasurer from 2016. I served 2 times as a branch treasurer, and then I was elected as the branch secretary in 2019, up until 2021, where I was elected as the treasurer of Johannesburg region. The EFF cardinal pillar number 4 states that our people must have access to free quality education, quality healthcare, quality houses, and quality sanitation. By so saying, our people must just not get healthcare, but the healthcare must be of a quality nature. The healthcare of a clinic that you get in Diepkloof must be equivalent to the healthcare of a clinic or a private clinic in Sandton. They must match, the services must be matched, or the standards must be matched. Also, in an EFF government, we will make sure that the clinics open 24 hours, 7 days a week. By doing that, we will also make sure that for that to take place or for that to be successful, we're going to have to hire more clinicians and doctors who are qualified to provide those services to our people in our healthcare centers. We also have social services, which include external social packages. Our people must access those social packages because it's their right. And we will also be monitoring early childhood development. We'll also be doing regular inspections to make sure that our early child centers development are in a standard that's actually giving the Black people or the people in our community dignity or dignified services. We also make sure that those clinics that will be operating 24 hours are actually going to be given 2 ambulances each for prompt or swift response in cases of emergencies, whether during the day or whether at night. They must always be available. We'll also make sure that we have equipment in the clinics that are over 10 years. Those equipment must not be in the clinic's premises, because obviously old equipment are not actually are part of the reasons why we are stuck and not having quality for our people. So getting rid of those equipment that are over 10 years will actually help us implementing those quality health services that are actually needed by our people. We'll also be providing sanitary towels in our clinics, as well as providing spaces or rooms where our traditional healers are going to be coming to be in consultations with the community, those who require those services. And we also be doing rehab, or we'll be making sure that we take off those people who are living at the streets, give them a place, especially those who are in use of drugs and substances. So drugs and substance abusers will actually make sure that they do get access to a quality rehabilitation center where we'll be actually be able to help them to better their lives and go back to our communities as influential people who are going to assist us. We'll also be making sure that our clinics or our branches or wards where we stay, they have a social worker who's going to be able to assist the community with all social related problems, be it in an indigenous household that needs extended social packages. They will work together with them to make sure families who have to get those social packages, they actually get those social packages. Did you know that Johannesburg, being the biggest city in the continent of Africa, does not have one single rehabilitation center which is owned by the city of Johannesburg? And yet, drug and substance abuse is one of the problems that we encounter as the city, especially in the inner city. EFF will come in harshly on that one. And we are saying we, as the EFF, will be the first to build a rehabilitation center that will be that will come and combat the use of drug, the abuse of drug and substances. That center, the first one that will be initiating or will be building, will be built at the Region D, which is in Soweto. That center is going to be the one which is used to actually accommodate all of our 7 regions in Johannesburg. From A to G, they will all be going to sub-region D for now until we get to plan the rebuild of others in other sub-regions. Drugs and substance abuse is one of our daily problems that we encounter. We have our youth which are living on the streets, smoking nyaupe. Nyaupe is now a biggest problem or a challenge in our youth, and we must make sure we actually end that and we take our youth to a rehabilitation center where we'll be able for them to come out as better people. With that incorporated, we will, like I said earlier, we will be having clinics operating 24 hours, 7 days a week. And we will be together incorporating that with public safety. So we will be having security guards or JMPDs who will be actually assisting us in making sure that our communities are safe. Healthcare practitioners in clinic are safe, as well as the patients who will be going or visiting the clinics at night, so that we don't have any problems of safety. With regards to health and social development for the residents of Johannesburg, the EFF is no longer the government in waiting. We are the government in charge, and we will ensure that we deliver economic freedom in our lifetime.